Chair of the Metro Coronavirus Task Force, Brad Goya with MBA representing independent schools, Theodora Pinnock, Assistant Professor of Pediatrics with Meharry Medical College. After the speakers conclude the remarks, we will take questions from the media. Please use the raise your hand function if you have a question to pose. Also joining us today are members of the School Reopening Planning Committee, Todd Dixon, CEO of Valor Collegiate and the Nashville Charter Collaborative, and Kathy Edwards, representing Vanderbilt Pediatrics, who, along with the aforementioned speakers, will be available for questions. Now I'd like to introduce Mayor Cooper.
Good morning, Nashville. Early this morning, I learned that Anna Shepard passed away last night, and I want to extend my heartfelt condolences to her husband, Larry, and her family. Anna served on the school board for 10 years, ably representing Donaldson, Hermitage, and Old Hickory, and she was, of course, the board chair. She had served as the board chair previously as well. Now, most recently, she played a major role in selecting Dr. Battle as our school director. Anna Shepard was a valued partner, someone whose thoughts I always sought out, and she will be missed. Back in March, when the coronavirus was first identified in Davidson County, we closed our schools as a public health precaution in order to protect our students, teachers, and support staff. MNPS students and their families have worked hard to continue their education through remote and virtual learning, and they've shown resiliency while finishing the 2020 school year. Yesterday, we announced a historic investment by providing every public school student in Davidson County with a laptop and ensuring everyone with internet access. Distance learning is a key element of our school's reopening plans, and we're going to help bridge the digital divide that places many of our MNPS families at a disadvantage through this $24 million investment from our federal CARES Fund allocation. When we reopen our schools, the coronavirus will still be in our community, but we will do everything possible to safeguard your health as you return to your classrooms for the 2020-21 academic year. That's why we formed a schools committee to develop protocols and procedures to safely reopen all our schools while mitigating the spread of COVID-19. We brought together leaders from our public and private schools, the Metro and from the Metro Health Department, Hugh Atkins, Environmental Health Bureau Director, Dr. Gil Wright, Associate Medical Director, and Dr. Joanna Shaw-Kaki, an infectious disease physician. This group has been developing our school reopening plan for over a month, and now you will learn more about how we will move forward safely and deliberately to help our students return to the classroom. And now it's my pleasure to introduce Amy Frog, Vice Chair of the Metro School Board.
It is with a heavy heart that I stand here before you today. Our school board chair and dear friend, Anna Shepard, passed away last night peacefully and unexpectedly. We have lost a tremendous leader who carried us through many difficult transitions as a board.
Please join me in remembering our school board chair, Anna Shepard, who passed away last night. Ms. Shepard was a strong leader who was serving her second term as the board chair. She was firm, and she could be tough on all of us at times with her challenging questions, but she was kind too, and she knew how to bring people together for a common cause. And she never gave up on fighting for the future of our students and our district and our city. That's why I enjoyed working with her. We're going to miss Anna and her leadership dearly. Every day, the one question I get asked the most is a simple one, with a not so simple answer. Will our schools reopen in time for the new school year? If health conditions in the city allow us to open safely in the traditional manner, nothing would make me happier. We need to get our students back in school. I think thousands of tired parents would agree. So over the last few months, I've been working closely with Mayor Cooper, Dr. Jahangir, other health experts, and leaders from Nashville's independent, Catholic, and charter schools to make sure we have a unified, safe, and equitable approach to reopening our schools on time. Our plan serves as a framework for all types of schools. It covers everything from instruction to cleaning to technology to transportation to athletics. It explains what we'll need to do to prepare school buildings for reopening and what students and their parents will need to do before coming to school each day. Here's the bottom line. We are scheduled to start school on Tuesday, August 4th, which is about 8 weeks from today. We have 3 basic scenarios to prepare for: a relatively normal school environment, a hybrid approach that involves significant social distancing and a combination of in-person and remote learning, and one we became all too familiar with this spring, with schools closed and all learning happening remotely. Using this plan as our framework, an internal task force at MNPS has been working to develop internal implementation plans for the 2020-2021 school year that will be based on these scenarios and the guidance provided, so we can be sure that every child in our district receives a great education, no matter what circumstances are thrust upon us. And Mayor Cooper's announcement yesterday that the city will spend $24 million in CARES Act funding for devices and internet connectivity for our students will make a huge difference on that front. Thank you again, Mayor. This won't be an easy task. We have faced challenges and will continue to face more on the road to an August opening. We will be releasing more detailed reopening plans specific to MNPS during the week of July 6th. And we anticipate being able to say which of the 3 scenarios we'll be starting schools with at that time so that parents and staff have adequate time to prepare. Supply chains for PPE, like masks, continue to have reliability issues, and we still need to identify and obtain significant funding for materials and resources if we're going to effectively implement our plans and ensure equitable access to education. Please understand that we are reviewing our plans and adjusting daily to health officials' guidance, CDC guidelines, and our local context. With the strong support of our school board, the mayor, the Metro Council, and the city as a whole, I believe we're up to the challenge and will come out of this as a stronger district because of this work. I am also grateful to be joined in this effort by independent Catholic schools and charter schools represented on the committee by Brad Joya with Montgomery Bell Academy and representing independent schools, Rebecca Hamill, Superintendent of Catholic Schools of the Diocese of Nashville, and Todd Dixon, CEO of Valor Collegiate and representing the Nashville Charter Collaborative. If it's safe to have a full in-person reopening across the district, we'll do it. And we'll follow the guidelines in the plan so we can keep everyone safe. Every student, every teacher, every principal, every support employee, every parent. It will take a citywide effort to create the conditions that will allow for a safe return to normalcy in Davidson County. We are already on our way. If we can maintain our progress and then maintain it some more, we can fully reopen our schools. So if you want to have school come back all the way in just 8 weeks, you can be a part of the solution. Please continue to practice social distancing and wear masks so we can continue to mitigate the spread of the virus. I'm extremely grateful for the patience, understanding, and cooperation of MNPS parents, students, and staff over the last 3 months. This situation has not been easy for anyone, but everyone has hung in there. I'm also grateful to Mayor Cooper, Dr. Jehangir, who is an MNPS graduate, to my colleagues in the broader education world, to the experts we've been working with at Meharry Medical College, Vanderbilt University Medical Center, and Opportunity Labs, to the 9 members of the school board for their leadership, and to everyone on my team at MNPS. We've come a long way since March. With a couple more months of hard work, a couple more months of taking care of ourselves and taking care of each other, we can go back to school the way we all want to on August 4th. Thank you, and now I'll turn it over to Dr. Jehangir.
Thank you, Dr. Battle, and good morning. I would like to begin by first thanking every committee member for their dedication and partnership to reaching this point. Just as we have the roadmap to reopen Nashville, we formed a committee to work on a roadmap to reopen schools. As chair of the COVID-19 task force, as a physician, and as a father to 3 school-aged children, I am proud and confident of the committee's work and recommendations. The upcoming school year will present challenges we've never faced, as we all learn how to resume our lives living with COVID. This plan is a good balance of public health concern and school protocols with the goal of keeping our students safe, our parents and educators and staff also safe. We looked at CDC guidelines, World Health Organization guidelines, and looked at other experts and best practices to guide our practice. More so, we wanted to make sure this was a plan that made sense for Nashville. We are so fortunate in our city to have national and international experts living right here, experts who kindly gave their time and their expertise to help make this plan tailor-made for Nashville. This morning, the city is still in phase 2 of our reopening plan, and we anticipate moving to phase 3 soon. If we continue the momentum that we have been doing to continue to flatten the curve, we will be able to open up schools with some adjustments and procedural changes as noted in this guidance. However, this all depends to all of you to please continue to adhere to what we have been doing and help protect the city from this virus. Now, we know getting our schools back to open is a really big part of our city's way of getting through this pandemic, and I'm grateful to all of you and my committee members for everything that we've done to be able to present a plan that will allow us to do this. I now would like to introduce Mr. Brad Gioia with Montgomery Bell Academy. Thank you.
Good morning. I was honored to serve on this committee representing independent schools, and I was particularly proud of the leadership of Dr. Jehangir and Dr. Battle, and I thought it was significant that they brought together independent schools, public schools, charter schools, Catholic schools, in the same way that we just heard the cities working together. It was vital, they thought, for our schools to work together. As you have also heard, we looked at guidelines from the CDC and the World Health Organization, and I was particularly pleased that the committee kept health and safety at forefront in our minds in every decision we made, but also tried to be as practical and thoughtful about the best practices to open up our schools in Nashville. I am very hopeful, as you heard Dr. Battle say, that we will all see school open up in August, and I hope, just as this committee worked hard together, the city will work hard together to make sure that this journey is a positive one for all of us. Thank you.
Good morning, Nashville. This was a great opportunity to have community leaders, health and education leaders come together and to try to come up with a great plan for our city to not only look after its children in coming back to school, but to try to allay some of the fears of us parents who've had children in the school system. I can say, as a member of this committee, it was a great opportunity to see your leaders hard at work trying to come up with good plans, safe plans, transparent plans. I can also say, as a developmental and behavioral pediatrician, that we looked after the children with special needs as well. And it was a great opportunity to lend a hand to this committee as a person, an employee of Meharry Medical College, and knowing that the community was ready to see its school come back and to see its children and parents come back in a safe and wonderful way. So with that, I'd like to say we're really glad to have had this opportunity to serve with our colleagues Vanderbilt as well, and to offer, if we could, any expertise that would help our city protect its children. Thank you.
Thank you. Also joining us from the committee today are Will Swan, Director Chief of the Nashville Fire Department, and Hugh Atkins, Bureau Director for Environmental Health Services with the Metro Public Health Department. And our first question comes from Julia Palazzo with WKRN.
Thank you, Sean. Good morning, everyone. Thank you so much for providing these details. Just a few questions. What happens, in any scenario, especially if kids are brought back? What happens if a parent chooses, they don't feel comfortable sending their child back to school? Will they be given the option of that they can stay home if they have maybe an underlying condition or family members at risk? And what happens if a student or someone on the staff does test positive? Will the school need to shut down? If so, for how long? And how often will schools be sanitized? Thank you.
Good morning again, and thank you for that question. What we've attempted to do in the plan that has been created by this great team is really create a high-level framework by which we will make those determinations. We still have to apply through the framework our local context by which we'll make decisions regarding closure and reopening as we move forward. What you'll also see in the plan are protocols by which each school has collaborated around and really committing to ensure the safety of everyone. As I mentioned specifically in the MNPS plan, we are looking forward to the week of July 6th to provide more details about the reopening plan, and at which time we'll determine if we're going to open back up in our normal state, in a hybrid situation, or remotely. And with that plan will come the additional details regarding any flexibilities for families for returning their students safely back to the school. You will see detailed plans in the framework that has been presented, protocols around positive cases. Again, we've aligned our protocols to the guidance from CDC as well as our local health experts. Thank you.
Thank you. Next up, we have Shayla Paz.
Good morning, Sean. Good morning, everybody. Thank you so much for taking my question. How does that precisely going to work as far as social distancing with the kids that they haven't seen each other in so long? They want to hug each other, and how are they going to be tested before going to school?
Thank you. Dr. Jahunger?
Well, thank you for the question. So let me start with the second part of your question. Part of this protocol does not require that students are just prophylactically tested before going back, nor employees based on our protocol. Now, the question of kids hugging and getting close, sure, there is that, and obviously we're going to encourage kids to wear masks, definitely when they're not sitting in the classroom. In the classroom, there'll be certain modifications made, desks facing forward, perhaps perhaps partitions on the sides of desks to keep kids from maybe, passing germs, keeping a window open for airflow to happen through the rooms. So there are certain provisions made in the hallways too. You'll notice once you read the protocol, there's, we'll have one ways, on each side of the hallway to try to minimize that interaction. But kids are kids, and I think it's where our parents need to have some conversations with their children, and everyone needs to just do what they can to make it happen. But it's not foolproof, and I think I want to be very clear. We're going to provide best practices and see what can happen, but kids are kids, and adults are sometimes adults, for what it's worth. So thank you.
Thank you. Next up, we have Alexandria Adams, WSMV. Alexandria, can you hear us? All right, we're going to go to Levi Ishmael, News Channel 5.
Yes, thank you so much for taking my question. Can you hear me just fine?
Yeah.
Okay, perfect. I guess my question for us is, we're talking about, some of these frameworks and discussions that we are having within committees, but I guess, is there any concern at this point that we're giving, some of these parents maybe 4 weeks to come up with, how they're going to adjust for potentially a hybrid situation where they might have to work with, working at home with their students, when we've seen how some of that, they present some challenges very early on when we first opened this discussion.
Thank you. Bring up Brad Goya.
Good morning. Again, thank you for your question. We know that the remote learning has certain challenges, and if it is a hybrid situation, I think that we have learned more and more about how to deal remotely and how to talk with our faculty about working both in person and through remote learning. I realize the time frame may be short, but I think there's no question that all of us need to be nimble. The numbers change and the guidelines continue to change. On a personal level, I was asked this past week if we would put a lot of information in our handbook about COVID-19 and how this year would be different. And I said, well, that would be probably silly because we know that we're going to have to adapt. And I think the best answer to your question is that all of us are going to learn to adapt well, I hope, and that 4 weeks' time is probably a runway where we can figure out how to adjust. And I hope that by early July, we do have a good sense of what will happen in early August so that schools can, as we've been saying, open fully. But if not, I think we can nimbly figure out a way to work with both remotely and in person.
We're going to try again for Alexandria Adams.
Hi there. My question to you guys is, this is obviously very sudden death to happen within the board with Ms. Shepard, but are there any plans right now to find someone else to fill her seat, and how does this impact the board?
So that's a Metro Council procedure to fill a replacement, and we defer to John Cooper in the Metro Council office as to the procedure for that. And next we have Nayela Alamila.
Hi, good morning. My question is, have there been any, have you guys talked about, different procedures for those teachers that help those kids that might need special needs, who actually might need to, that help them physically? Can you tell us a little bit about what you guys might be doing for those children?
Yeah, we'll bring up Theodora Pinnock.
Good morning again. I think those needs are going to they're being looked at, but they'll have to be balanced within the guidelines to keep the children, even with special needs, safe. And they have certain disabilities and underlying conditions that might also impact health. So decisions are being made to help those children with those needs.
Thank you. And that's all the questions we have in the queue for today. Thank you for joining us, and we'll have a video available later this afternoon. Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.